If your parents are over 70, there's a very uncomfortable truth you need to hear. Some medications that once helped them can now quietly harm them. And here's the scary part. These drugs are still commonly prescribed, every single day. As a doctor, I've had moments where I looked at a prescription list and thought, I would never let my own parents take this. Today, I'm going to share 5 medications I personally avoid for elderly patients and why you should think twice too. As we age, the body changes slowly, silently. The liver doesn't process drugs the same way. The kidneys slow down. The brain becomes more sensitive. So a medication that felt normal at 40 can become dangerous at 70. This isn't about fear. It's about awareness. Because when used carefully, medicine saves lives. But when used blindly, it can take away independence, memory, and even safety. Let's walk through these 5 medications calmly, clearly, like I would explain to my own family. What it is these are. Medications like sleeping pills often given for insomnia or anxiety. Why it's a problem in older adults? These drugs don't just help with sleep, they slow the brain. They can cause confusion, dizziness, and delayed reaction time. Real-life example, I once saw a patient who started a sleeping pill because she couldn't sleep. Within a week, she fell in the bathroom at night and fractured her hip. Hidden risk, many people think it's just for sleep. It's harmless. But in seniors, these drugs double the risk of falls and memory problems. Practical advice instead of strong sleeping pills. If medication is needed, doctors should choose safer, low-dose options carefully. What it is common painkillers used for arthritis, back pain, or joint stiffness. Why it's a problem. These drugs can damage the stomach lining and even worse, harm the kidneys over time. Real-life example, an elderly man took painkillers daily for knee pain. He ended up with stomach bleeding without even realizing it until it became severe. Hidden risk, people assume it's over the counter, so it must be safe. But in older adults, these medications can cause silent internal bleeding. Practical advice, what it is, these include some allergy medicines, cold medicines, and bladder control drugs. Why it's a problem, they affect brain chemicals, and in seniors that can lead to confusion, memory loss, and even delirium. Real-life example, a patient came in with sudden confusion. The cause? A simple over-the-counter cold medicine. Hidden risk, people don't connect these medications with brain health, but long-term use has been linked to increased risk of cognitive decline. Practical advice, what it is, some older diabetes drugs can drop blood sugar too low. Why it's a problem in elderly patients, low blood sugar is extremely dangerous. It can cause fainting, confusion, seizures, even death. Real-life example, an older woman skipped one meal but still took her usual diabetes pill. She collapsed at home due to low blood sugar. Hidden risk, many think lower sugar is always better. But in seniors, overly aggressive control can be more harmful than slightly higher levels. Practical advice, what it is, these are drugs often given for anxiety, stress, or agitation. Why it's a problem? They can cause sedation, confusion, and dependence, especially in older adults. Real-life example, a man started anti-anxiety medication after losing his spouse. Within weeks, he became withdrawn, forgetful, and unsteady on his feet. Hidden risk, people believe these drugs calm the mind, but in seniors, they can dull the brain too much. Practical advice, asterisk, start with non-drug approaches like counseling or relaxation techniques, asterisk. If medication is needed, use the lowest dose and shortest duration, asterisk, monitor closely for changes in behavior. Here's the truth. It's not that these medications are bad. It's that the body changes, and what once helped can now harm. Sleeping pills can lead to falls, painkillers can cause bleeding, cold medicines can affect memory, diabetes drugs can dangerously drop sugar, and anxiety meds can cloud the mind. The goal isn't to stop everything, it's to use medicine wisely. If you have parents over 70, take a moment today, look at their medication list, ask questions, talk to their doctor, because sometimes protecting their health isn't about adding more medicine, it's about removing the wrong ones. If this helped you, share it with someone who cares for aging parents. Remember, good care isn't complicated, it's thoughtful.